Dear friends, the subject of my talk today is COVID management, its homeopathic perspective, and experiences from our center at Agra, India. Coronaviruses are not new. It's a large family of viruses responsible from simple common cold to diseases, very severe respiratory diseases. SARS-CoV-2 is a new type of coronavirus. This virus has a great capacity to replicate, to multiply, and to transmit. The transmission is very, very fast than previous COVID-19 variants. The recent example is the Delta Plus variant. Now, this virus is a matter of concern. It's a variety of concern. It's very virulent and very fast multiplying. And you see, coming to the homeopathic perspective now, that is the most important thing. If we go to the field of virology, we find there's so much in it, the homeopathic principles and philosophy. Virus cannot do anything on its own till it gets a host cell to stay and multiply. And this depends upon the individual susceptibility. You see, everything is with the immune system. And homeopathy from the day one talks about susceptibility, immunity of an individual. The biggest advantage of homeopathy, which I would like to elaborate in the beginning, is it does not have to wait to have a full knowledge of the viral activity. It gets the symptomatology and it starts. Our Metra Medica, our homeopathic Metra Medica armamentarium is so rich with symptomatology that we are ready from the day one to start treatment of these diseases and also for all future viruses to come. Having said this, now this is the biggest homeopathic advantage. The second thing is we do so much work with these viruses in homeopathy, but we have no recognition much as we should have. We do not have that much awareness. So we should publish our works in a scientific manner which is palatable to the modern scientist. We should publish and we should prepare a statistics of our result, a data. For this, we should all have a data pooling. This will give us more global awareness as a homeopath. Coming to the main subject, and that is the homeopathic perspective, I will talk to you about the presentation, treatment, especially the therapeutic aspect. If we look at COVID infection, we find that this presents as a wide spectrum. At the beginning of the spectrum, we have prophylaxis. We will talk about this a little later. And then we have the milder cases who have in the beginning just symptoms of a cold, feverishness, sore throat, and a little cough. Then we have moderate to severe cases. The moderate severe cases have little advanced symptoms, and many times they have many clinical complications associated. In these moderate cases and severe cases, there is another variety of severe cases with comorbidities. These are the patients already diabetic, hypertensive, coronary artery disease, cancer, or autoimmune diseases they are suffering from. They have more severity of the symptoms with this infection. And now, a very important, very, very important At the end of the spectrum is the long COVID syndrome, where homeopathy does a very, very positive work. When we come to the beginning, mild cases with beginning of the symptoms, the most commonly used remedies that have evolved have been, I will not go into the detailed mathematica, have been belladonna. Now, belladonna is like a storm. It comes suddenly after aconite. There's a high fever on the very first day. There's a throbbing headache. There's burning, there is heat, there is redness. Patient starts getting delirious. And we found that belladonna has been found to be very important remedy at the beginning of these cases in the second wave in India, when we had this Delta variant. Because the virus has been very aggressive in 2021. Gelsemium, a mild variety, just a cold, beginning of cold, heaviness of the head, feverishness. Patient says he looks for temperature in the thermometer, it doesn't come, but he feels feverish. Drowsiness, wanting always to lie down. This was a remedy to start with in the last COVID wave, that was in 2020. Bryonia. Bryonia is in midway, that is on the 4th or the 7th day, when the patient starts getting aching all over the body, the myalgia, getting thirsty, when there's a gastric involvement, when there's a dry cough and the chest starts hurting. And then ferrum phosphoricum. Now this comes midway between belladonna, gelsemium, midway between belladonna, bryonia, when inflammation starts dominating, but not to the extent of belladonna. The severity of inflammation is not that of belladonna, but now it is getting little chronic, little settling down. So ferrum phosphoricum is a settling inflammation, a maturing inflammation with redness and fever. And Eupatorium purf, a wonderful remedy with the bone pains, the muscles pain, and the bilious vomiting. Symptoms like intermittent fever. I will not go into the details, but I'll just give you the key points. Coming to the moderate to severe cases, the most important remedies has been phosphorus, carbovegetabilis, and aspidosperma. There could be a long list of remedies, but these are the most important evolved at our center, and we would like to share our experience. Phosphorus is a wonderful remedy for the respiratory system where the virus attacks. This virus is very fond of throat and upper respiratory tract and the lungs. Phosphorus has everything in the chest: burning, stitching, pain, heaviness, and cough. Hurting cough hurts the chest, and finally phlegm with blood, the rusty sputum. Phosphorus also has fever. Phosphorus also has fear in these cases. The oxygen level is now starting to go down because there is a pathology. The fibrosis is starting to get settled. There is pneumonia. There is pleuritis, pleural effusion. So you find all these in phosphorus, and phosphorus is complementary to arsenic, which is a very important prophylactic, which I will talk at the end. Phosphorus is complementary to bryonia and follows bryonia well. Carbovegetabilis, is a life-saving medicine in homeopathy with its indications. There is an air hunger. Oxygen is going low and low. The extremities are getting blue, cyanosed, and cold with sweating, and the patient is gasping, has an air hunger, as they say. This remedy has been able to improve the oxygen saturation in many patients who always needed a very high level of oxygen during their treatment. Aspidosperma is an organ remedy, a small organ remedy, and it's also called as digitalis of the lungs. Now, it has a marked action on the respiratory center and, of course, on the lungs. It improves the oxygen saturation, and hence, patients with oppression of breathing, dyspnea, respond very well to aspidosperma. We use it mostly in drop doses of the mother tincture or in lower potencies, could be D3, and repeat it as needed, as early as 2 hours or 3 hours. The other remedies which I've been talking to you in the milder cases and the moderate cases and the severe cases, the potencies that we use is normally 30, and we repeat it often as needed. Could be 3 hourly or 4 hourly. We reduce the number of doses as the improvement sets in. So this was about repetition and potencies as well. Now, there is another group of rare remedies which have been used for desperate cases of this COVID infection. In homeopathy, what you get? Three things I always say. One is the prophylactic for this disease. Second are the milder cases in the beginning who become all right. And third, very important, are the complicated cases which are dying and which are in the intensive care unit of the hospital. Here also homeopathy has a great role to play. Hydrocyanic acid, prussic acid. This remedy has the symptomatology of lungs collapse. The lungs are collapsing, lungs are failing. And with the result you have, with the paralysis of the lungs, you have symptoms of convulsions, cyanosis, and a dying patient. See, a dying patient with convulsions, with paralysis, gasping for air, is hydrocyanic acid. Vanadium metallicum, a rare remedy. This metal has a affinity for oxygen transportation, carrying oxygen to the places where there is infection. So it helps the phagocytes to fight with the infection, carrying oxygen more to the areas where there is a deficiency of oxygen in the cells. It doesn't have other much symptomatology because this is not a well-proved remedy. It's a clinical remedy, needs further proving. Laurocerasus. Well, I have been using this medicine mostly in congenital heart of children with clubbing of the nails and cyanosis. But this remedy has proved to be very useful in advanced severe cases of COVID-19 infection when there is a lot of cough with involvement of the heart and the lungs. You find in the books cough with valvular diseases of the heart. You find here cough with heart involvement, which is very common in COVID-19 infection, especially myocarditis, and the inflammation of the lungs. There is a lot of cough. So cough with complication of the heart, this is a grand remedy, laurocerasus. We also use some organ remedies in mother tinctures and lower potencies. Lower potencies is 1x, 2x, 3x, and one of the most important is Crataegus oxycantha. This is used in drop doses of the mother tincture for all the cardiac associated complications. Myocarditis, pericarditis, or anything, palpitation, discomfort, oppression of breathing connected with the heart. It acts on every part of the heart, the muscle, the valves, even the electrical conducting system of the heart. It's a clinical remedy. And it also gives a vital strength to the patient suffering from this viral infection. Justicia adatoda is an Indian herb, a great remedy for lungs and the respiratory tract, where cough is very, very annoying. It doesn't abate. Now, Justicia does not have that much of phlegm. It's more of a dry cough, but with pain in the chest and dyspnea. So, when the cough remains after COVID infection for a long time, when you in a follow-up you find that the cough dates back to COVID infection, you have Justicia in drop doses of the mother tincture. We normally give 5 drops of the tincture with little an ounce of water twice daily. Seneca is other organ remedy for the respiratory tract and has been found to be very useful in COVID infections, especially with the respiratory complication. Now, this has the combination of cough with expectoration, which is difficult. There is a rattling of chest. Now, this clinical remedy is very near to entim tart. So now you understand what is Seneca. Rattling in the chest, difficult to expectorate, chest full of phlegm, dyspnea, cough. This is also used in drop doses of the mother tincture. And no matter what it is, chronic bronchitis, bronchiectasis, pleuritis, you name the respiratory pathology, with its indication, Seneca is there to help you. This was just the clinical experiences I was sharing with you. But now, another very important problem is long COVID, post-COVID complications. This is coming in a large number to a homeopath. We feel very tired, sir, after we got this infection. We don't feel like working. We always have a heaviness of the head. I have no appetite. My sleep is disturbed. I don't want to talk. You get all these symptoms. And then for them, you again have very important clinical and organ remedies. China officinalis is, of course, a remedy for debility after an exhausting disease, or if there has been a lot of phlegm, or there has been hemorrhage. So there have been a persistent fever and chills. China officinalis, we use it in 30 potency. Picric acid. Now, this is a wonderful remedy. You can understand this remedy if you know gelsemium. So you must understand that this more severe form of gelsemium is picric acid. Patient is so tired after this infection. Doctor, I've been out of COVID now for 1 month, but still I always want to lie down in the bed. I don't want to do any work. Picric acid, profuse mental and physical debility. Phosphoric acid. So I'm not going into the details of Metromedica because you will know through the textbook, but I am just sharing exact experiences we have. Phosphoric acid, a grand remedy for debility, you know. Now, what kind of debility? Mental weakness. Here are the depressed patients after COVID who are mentally tired, who are losing memory. Now see, the most important point in phosphoric acid is those depressed post-COVID patients who have lost their family members, who have lost their friends, or who have seen deaths by the side of their bed in the hospital. So here is an element of mental weakness, physical weakness with grief and depression. That is phosphoric acid. It will bring you out. The potency used is C30. Another medicine, very important, organ remedy used in drop doses is Avena sativa. It's a nervine tonic, we all know. It's a tonic for the nervous system. Now, when you don't understand what to give in this long COVID patient who recovered from COVID, but we don't get symptomatology of picric acid, we don't get symptomatology of China or acid phos. we can go for drop doses of this mother tincture. It's like pick me up after this COVID infection. And then Kali phosphoricum, Schussler salt, proved by Schussler, but now into homeopathic mater medica with verified symptoms, used in 6x or D6 potency, a great pick me up like Avenus sativa after COVID infection. It gives strength to the nervous system, it improves the memory, it gives you a feeling of joyfulness, it improves the quality of sleep. It's a wonderful medicine after COVID to improve the quality of sleep. And also, it's a wonderful medicine for advanced pathologies recovering from. For example, a very advanced cancerous pathology, gangrenous pathology, foul swelling pathology. To recover from them, Kali phosphoricum is a very important remedy. So, my dear friends, with these little information about the remedies that I shared with you, I would like to also talk with you something very important before I conclude. I have been very brief in my presentation because I have a allotted time. If you have any questions or query, you can always contact us. And the most important thing is when you are treating a COVID infection, first think in your mind to which category of the spectrum this case belongs. The spectrum I showed you. Then move further. And you should clinically know what is happening. You should have a full knowledge of what is D dimer. What is the implication of a rising D dimer? You have a lot of thromboembolic phenomena, coagulation defects in this infection. Then you should also know the inflammatory markers, the CRP, serum ferritin. You should also know about the significance of IL-6. You should know what is a cytokine storm. See, it is very important to update yourself with the evolved pathology. What is happening inside? Now, why this is important? This is not important for your prescribing, I know, but this is important for you to know the prognosis of an individual case. And most important, this will also let you know your limitations, where to stop, where the patients immediately need hospitalization. Remember, an acute emergency, an acute COVID emergency in respiratory distress with low oxygen saturation almost always needs hospitalization. And you should advise that. A very severe case will immediately need accessory medical help in an intensive care unit. You can support it with an add-on homeopathy, but needs a hospital care. You should be very clear about this. Many cases, complicated cases, dying cases who are not responding to steroids and the antivirals, the oxygen saturation was going down and down. The add-on homeopathic medicines did a great job here. Remedies like carbo vegetables, arsenic, phosphorus did a grand job here. So you should be very, very careful with all these important information. Thirdly, work is going on of this infection all over the world. In the homeopathic field, LMHI gives you the global information and it updates you with global information on its site. The government bodies, especially in India, the Central Council for Research in Homeopathy, is doing a great research work in a very, very planned, following all the research protocols, and they are coming up with great medical help for the suffering people. In the last, I would say, that you should contribute as a homeopath. But as I said, we are not getting that much recognition. We are not getting that much awareness in common masses and uh, in the world. It is because we are not giving information in a documented manner. So we must document in a uh, research profile and then present it to our colleagues. Finally, my father has been telling me from day one, why don't you have prepared the nosode for this virus? Why don't you prepare the nosode for this virus? And I always tell him, no, no, we are working on it. The CCRH, the Central Council for Research in Homeopathy, is working on it, and very soon it will be there. That reminds me of an old man in mid-90s suffering from senile dementia and staying with us in our house for some time, one of our far relatives. He was sitting with me quietly, not talking much, and suddenly one day he told me, homeopathy will have the answer for this viral disease. Homeopathy will have answer for this viral disease. He said with great confidence. And I asked him, hey, normally you don't talk, but why do you say this? He says, because he has been an engineer. He says, because these viruses are very, very micro and the homeopathic doses are very, very micro. So one day you will only get result from homeopathic science. But we should also appreciate the other researches going on. We should appreciate our colleagues working on it in other schools of medicine. Our ultimate aim is to cure the sick humanity. That is all for today. Thank you very much.